Hello again and happy Monday from Metro Manila, the Philippines, Southeastern Asia. The North Korean communist dictator Kim Jong Un is temporarily suspending travel between China and his country, even though China, as a much richer, albeit still officially communist dictatorship, is basically its lifeline economically in order to reduce the number of COVID-19 infections in North Korea. This is by Joshua Berlinger of CNN, updated today on November the 30th, 2020. Kim Jong-un appears to have kicked North Korea's pandemic prevention plan into overdrive, further tightening the country's nearly impassable borders, cutting off nearly all trade with China, and even allegedly executing a customs official for failing to handle imported goods appropriately. Beijing exported just $253,000 worth of goods to Pyongyang in October 2020, a drop of 99% from September to October, according to data published by China's Customs Administration. For context, that's less in terms of dollar value than China exported to Liechtenstein and Monaco, two European microstates, during October. China is North Korea's biggest trading partner and effectively the Kim regime's economic lifeline. The country basically doesn't import significantly from anywhere else. Before major United Nations sanctions were put in place as punishment for North Korea's nuclear weapons program in 2016 and 2017, Beijing accounted for over 90% of Pyongyang's foreign trade. The new customs figures, if accurate, show that dictator Kim appears to be willing to pare back or even cut off trade with China to prevent the COVID-19 virus from entering North Korea, even if it means risking the country's food and fuel supply. Since the 1990s, North Korea has tragically suffered from malnutrition, even hunger, among many of its civilians, while continuing to bolster its army. So it shows where the regime's true priorities lie. The move is even more extreme considering mainland China is only reporting a handful of cases each day, although of course we should view such statistics critically given the fact that China is still a communist dictatorship and surely it wouldn't like to publish very unfavorable figures. So it's quite likely that China is understating the number of cases, both cumulative and ongoing ones, and the number of deaths. That being said, even if there was gross exaggeration or like downplaying of such figures, China would be nowhere close to the United States in the number of cumulative cases, deaths, and ongoing cases. North Korea has not publicly acknowledged the drop in trade or the reason behind it, but the pandemic is the most likely explanation. Kim reportedly had 2 people executed for COVID-19 related crimes, including a customs official who did not follow virus prevention rules while importing goods from China, a South Korean legislator said after being briefed by the country's spy agency. CNN has not been able to independently confirm news of the execution, nor have North Korean officials publicly condemned it. North Korean state media reported on Sunday that authorities were enacting new stricter anti-epidemic measures across North Korea, including increasing the number of guard posts at border crossings and tightening the rules of sea entry in coastal areas. North Korea's decision to scale back imports from China has affected trade in the other direction. The October customs data from Beijing showed that Chinese imports from North Korea are down by 74% year on year. That has forced industries in China, such as hair and wig manufacturers, to search other countries for cheap labor. North Korea was one of the first countries in the world to shut its borders when news of COVID-19 emerged from Wuhan, China, at the end of or towards the end of December 2019. Almost all travel into North Korea ceased shortly after, and this past summer, the city of Kaesong was placed under lockdown after reports that a defector possibly brought the virus in. North Korean state media regularly carries pieces reminding its people on the importance of its emergency anti-epidemic program. North Korea's crumbling healthcare infrastructure is unlikely to be up to the task of treating a large number of patients sickened with a virus that the global healthcare community still does not fully understand. Defectors who have fled North Korea and aid workers who have volunteered there say North Korean hospitals and medical facilities are often dilapidated and lack proper equipment and medicine. While North Korea has not yet publicly admitted to a single case of COVID-19 within its borders, many question that an infectious disease that has killed over 1.4 million people worldwide and affected over 63 million did not make it inside North Korea. Evans Revere, a former U.S. Assistant Secretary of State for East Asia and the Pacific, believes the latest steps taken by the Kim regime suggest that an already serious situation, the pandemic, has gotten a lot worse. North Korea has yet to comment on President-elect Joe Biden's victory in the U.S. elections. Biden will likely approach negotiations with Pyongyang much differently than the outgoing President Donald Trump, who established a personal relationship with Kim in the hopes that it could lead to a diplomatic breakthrough. CNN's Yeon Jung Seo, Gawon Bae, and Rebecca Wright contributed to this report.